Welcome to the Sinoe Medical Association 2-hour USMLE Clinical Case Review Marathon. During this session, we will solve high-yield clinical cases from every major organ system while reviewing pathology, physiology, and management. You should pause before each answer, identify the diagnosis, determine the mechanism, and select the next best step. Let's master the 5-step USMLE method. First, identify the patient, age, sex, and risk factors. Second, establish the timeline. Is it acute, chronic, or progressive? Third, find the dominant syndrome. Fourth, identify the discriminator clue. Finally, answer exactly what the question is asking. We begin with Section 1, the cardiovascular and respiratory systems. 5 integrated cases to test your clinical reasoning. Case 1. A 62-year-old man presents with acute, crushing substernal chest pain. ECG shows ST elevation in V1 through V4. What is the most likely culprit artery? A. RCA, B LAD, C LCX, D PDA, or E left main. Pause now and select the single best answer. The correct answer is B, the left anterior descending artery. This patient has an anterior wall MI, localizing to the LAD distribution. The decisive finding is ST elevation in the precordial leads. The LAD supplies the anterior wall and septum. Remember, stabilization with aspirin and heparin is the next step. The USMLE trap is confusing anterior leads with inferior ones. Always correlate the leads with the specific coronary anatomy. One sentence takeaway. ECG localization is your best friend in the ER. Case 2. A 68-year-old woman with a history of hypertension and long-standing tobacco use presents with progressive dyspnea and bilateral lower extremity edema. Examination reveals jugular venous distension and a hollow systolic murmur at the lower left sternal border that increases with inspiration. What is the most likely underlying mechanism? A. Left ventricular failure. B. Pulmonary hypertension. C. Aortic stenosis. D. Mitral valve prolapse. Or E. Ruptured chordae tendini. Pause and select. The correct answer is B. Pulmonary hypertension. This patient has tricuspid regurgitation. Carvalho's sign, increased intensity with inspiration, is the discriminator, pointing to right-sided pathology, likely secondary to chronic lung disease. The decisive clue is the inspiratory increase in murmur intensity. This separates tricuspid regurgitation from mitral regurgitation. Foundational science connection. Chronic lung disease leads to core pulmonale and secondary TR. Case 3. A 72-year-old man with a history of palpitations and lightheadedness. ECG reveals an irregular rhythm with no discernible P waves and a heart rate of 140. What is the most appropriate next step in management for a hemodynamically stable patient? A. Synchronized cardioversion. B. Unsynchronized cardioversion. C. Rate control with beta blockers. D. Adenosine, or E. Amiodarone. Pause and select. The correct answer is C. Rate control with beta blockers, or calcium channel blockers. In a stable patient with atrial fibrillation, the first step is rate control. Synchronized cardioversion is reserved for unstable patients. Case 4. A 45-year-old woman post-orthopedic surgery presents with sudden onset shortness of breath and pleuritic chest pain. CT pulmonary angiogram reveals a large filling defect at the bifurcation of the pulmonary arteries. What is the most likely additional physical exam finding? A. Increased breath sounds. B. Loud P2 component of S2. C. Mid-systolic click. D. Pulsus paradoxus. Or E. Opening snap. Pause and select. The correct answer is B. Loud P2 component of the second heart sound. This patient has a massive pulmonary embolism, causing acute pulmonary hypertension and right heart strain. Loud P2 is a classic finding of pulmonary valve closure against high pressure. Case 5. A 30-year-old patient with severe sepsis develops progressive respiratory failure. Chest X-ray shows diffuse bilateral alveolar opacities. Arterial blood gas shows a PaO2 to FiO2 ratio of 150. What mechanical ventilation strategy improves mortality? A. High tidal volume. B. Low tidal volume. C. Low PEEP. D. high FiO2 only? Or E, high inspiratory pressures? Pause and select. The correct answer is B, low tidal volume ventilation. In ARDS, lung protective ventilation with 6 milliliters per kilogram of ideal body weight reduces barotrauma and improves survival. This is a critical step 2 management point. Section 2, renal, electrolytes, and acid-base disorders. 4 cases to master the kidneys. Case 6, a 55-year-old man, post-aortic aneurysm repair, develops sudden oliguria. BUN is 24, creatinine is 2.0. Urinalysis shows muddy brown granular casts. What is the most likely diagnosis? A, prerenal azotemia, B, acute tubular necrosis, C, postrenal obstruction, D, glomerulonephritis, or E, interstitial nephritis. Pause and select. The correct answer is B, acute tubular necrosis. The discriminator is muddy brown casts and a BUN to creatinine ratio less than 20. This is the most common cause of intrinsic AKI in hospitalized patients. Case 7. A 35-year-old man with HIV presents with generalized edema and massive proteinuria. Renal biopsy reveals sclerosis in capillary loops of some, but not all glomeruli. Light microscopy is shown here. What is the most likely diagnosis? A, minimal change disease, B, focal segmental glomerulosclerosis, C, membranous nephropathy, D, diabetic nephropathy, or E, amyloidosis. Pause and select. The correct answer is B, focal segmental glomerulosclerosis. In an HIV-positive patient, FSGS is the classic high-yield association. Segmental sclerosis means only a portion of the glomerular tuft is involved. Case 8. An 80-year-old woman is brought to the emergency department for confusion. Her serum sodium is 122 milliequivalents per litre. She appears euvolemic on examination. Urine osmolality is 400. What is the most likely cause of her hyponatremia? A, SIADHB, dehydration, C, heart failure, D, psychogenic polydipsia, or E, hypothyroidism. Pause and select. The correct answer is A, SIADH. This patient has hypertonic euvolemic hyponatremia with inappropriately concentrated urine. Remember, small cell lung cancer is a major USMLE association. Case 9. A 50-year-old patient with chronic obstructive pulmonary disease and recent vomiting presents with the following arterial blood gas results: pH 7.25, PaCO 230, and bicarbonate 12. The serum sodium is 140 and chloride is 100. What is the primary acid-base disorder? A, metabolic acidosis with respiratory alkalosis, B, metabolic alkalosis with respiratory acidosis, C, triple acid-base disorder, D, compensated metabolic acidosis, or normal acid-base status. Pause and select. The correct answer is A, anion gap metabolic acidosis with a concomitant respiratory alkalosis. pH 7.25 indicates acidemia. Bicarbonate 12 confirms metabolic acidosis. The calculated anion gap is 28, which is elevated. Using Winter's formula, the expected PaCO2 is 26. Since the actual PaCO2 is 30, there is a mixed disorder. Section 3. Gastrointestinal, hepatic, and nutritional disorders. 4 cases to master the GI system. Case 10. A 45-year-old man presents with bright red hematemesis and epigastric pain. He's been taking high-dose ibuprofen for chronic back pain. Endoscopy reveals a bleeding ulcer in the gastric antrum. What is the most appropriate next step in management? A, intravenous proton pump inhibitor, B, urgent surgical consultation, C, endoscopic therapy, D, barium swallow, or E, H. pylori breath test. Pause and select. The correct answer is C, endoscopic therapy. For an active upper GI bleed, endoscopy is both diagnostic and therapeutic. PP is used adjutantly, but the immediate management is stabilization and endoscopic control. Case 11. A 24-year-old woman presents with chronic bloody diarrhea and abdominal pain. Colonoscopy reveals a cobblestone appearance of the mucosa with skip lesions. What is the most likely diagnosis? A. Crohn's disease, B. Ulcerative colitis, C. Celiac disease, D. Irritable bowel syndrome, or E. Ischemic colitis. Pause and select. The correct answer is A. Crohn's disease. The presence of skip lesions and transmural inflammation are the discriminators from ulcerative colitis, which is continuous and mucosal only. Non-caseating granulomas are also characteristic. Case 12. A 40-year-old woman presents with severe epigastric pain radiating to her back, accompanied by persistent nausea and vomiting. Laboratory studies show a serum lipase level 3 times the upper limit of normal. Ultrasound reveals multiple gallstones. What is the most likely late complication of this condition? A. Pancreatic pseudocyst, B. Pancreatic necrosis, C. Hypocalcemia, D. Pancreatic abscess, or E. Pancreatic adenocarcinoma. Pause and select. The correct answer is A. Pancreatic pseudocyst. This is a common complication, appearing weeks after an episode of acute pancreatitis. It is a collection of fluid and enzymes surrounded by fibrous tissue, not a true epithelium-lined cyst. Case 13. A 50-year-old man with a history of chronic alcohol use disorder is brought to the hospital for confusion, unsteady gait and abnormal eye movements. Examination reveals horizontal nystagmus and truncal ataxia. What vitamin deficiency is responsible for this triad? A. Vitamin B1, B. Vitamin B3, C. Vitamin B6, D. Vitamin B12, or E. Vitamin C. Pause and select. The correct answer is A. Vitamin B1 or thiamine. This is the classic Wernicke encephalopathy triad. Thiamine is a cofactor for pyruvate dehydrogenase and alpha-ketoglutarate dehydrogenase. Glucose administration before thiamine can worsen the condition. Section 4. Endocrine and reproductive systems. 5 cases to master hormone regulation and pregnancy. Case 14. An 18-year-old girl with type 1 diabetes is brought to the ER with nausea, vomiting, and abdominal pain. Her blood glucose is 500, and her arterial blood gas reveals a pH of 7.2. What is the most appropriate initial management step? A. Intravenous insulin bolus, B. Intravenous fluids with normal saline, C. Potassium replacement, D. Sodium bicarbonate, or E. Subcutaneous insulin. Pause and select. The correct answer is B. Intravenous fluids. The first and most critical step in DKA management is fluid resuscitation to restore intravascular volume. Insulin therapy should follow once potassium levels are confirmed. This sequence prevents circulatory collapse. Case 15. A 40-year-old woman is found to have a firm, non-tender nodule in the left lobe of her thyroid. Ultrasound reveals a hypoechoic nodule with irregular borders. A radioactive iodine uptake scan shows the nodule is non-functioning, or cold. What is the most appropriate next step in management? A. Fine needle aspiration biopsy, B. Repeat thyroid ultrasound in 6 months, C. Computed tomography of the neck, D. Immediate radioactive iodine therapy, or E. Start levothyroxine. Pause and select. The correct answer is A. Fine needle aspiration biopsy. A cold nodule on uptake scan carries a higher risk of malignancy. FNA is the most accurate diagnostic step to evaluate for thyroid cancer, such as papillary carcinoma. Ultrasound-guided FNA is often preferred for precision. Case 16. A 30-year-old woman presents with worsening fatigue, weight loss and darkening of her skin, especially on her palmar creases. Her blood pressure is 90/60. Laboratory tests show hyponatremia and hyperkalemia. What is the most likely underlying mechanism? A. Autoimmune destruction of the adrenal cortex, B. Pituitary adenoma secreting, A. CTHC, ectopic ACTH production, D. Sudden cessation of exogenous steroids, or E21 hydroxylase deficiency. Pause and select. The correct answer is A. Autoimmune adrenalitis. This is Addison's disease. Hyperpigmentation occurs because A. CTH and melanocyte-stimulating hormone share a common precursor, pro-opiomelanocortin. Hyperaldosteronism explains the sodium and potassium findings. Case 17. A 28-year-old woman at 32 weeks gestation presents with a severe headache and blurry vision. Her blood pressure is 165/110 and urinalysis shows 3+ proteinuria. What is the most appropriate next step in management? A. Start magnesium sulfate infusion. B. Oral nifedipine. C. Immediate induction of labour. D. Start methyl dopa. Or E. Intravenous hydralazine. Pause and select. The correct answer is A. Magnesium sulfate. In a patient with preeclampsia and severe features, headache and blood pressure over 160, the priority is seizure prophylaxis with magnesium. This prevents progression to eclampsia. Controlled delivery is the definitive treatment, but requires stabilisation first. Case 18. A 32-year-old woman at 26 weeks gestation undergoes a 1-hour 50-gram glucose challenge test. Her plasma glucose is 160. What is the most appropriate next step to confirm the diagnosis of gestational diabetes? A. Perform a 3-hour 100-gram oral glucose tolerance test. B. Measure hemoglobin A1c. C. Measure fasting plasma glucose. D. Repeat the 1-hour challenge test in 1 week. Or E. Start subcutaneous insulin. Pause and select. The correct answer is A. 3-hour oral glucose tolerance test. The 1-hour challenge is a screening test. A result over 140 requires a diagnostic 3-hour OGTT to confirm gestational diabetes. Accurate diagnosis is essential to manage risks to both mother and fetus. Section 5. Neurology, Psychiatry and Special Senses. 5 cases to master the nervous system and mental health. Case 19. A 70-year-old man is brought to the hospital for sudden onset right-sided hemiparesis and expressive aphasia. MRI of the brain shows an acute infarct in the left cerebral hemisphere. Which cerebral artery is most likely occluded? A. Anterior cerebral artery. B. Middle cerebral artery. C. Posterior cerebral artery. D. Basilar artery. Or E. Vertebral artery. Pause and select. The correct answer is B. Middle cerebral artery. The combination of right-sided weakness, sparing the leg, and Broca's aphasia localizes the lesion to the left MCA distribution. Remember, global aphasia involves the entire MCA territory. Case 20. A 25-year-old man is brought to the emergency department while experiencing a generalized tonic-clonic seizure that has lasted for 10 minutes. He has not regained consciousness between episodes. What is the first-line pharmacologic treatment for this patient? A. Intravenous lorazepam. B. Intravenous phenytoin. C. Valproic acid. D. Ethosuximide. Or E. Levetiracetam. Pause and select. The correct answer is A. Intravenous lorazepam. This patient is in status epilepticus. Benzodiazepines are first line to terminate the seizure. This rapid intervention protects the brain from excitotoxic injury while you prepare second-line agents. Case 21. An 80-year-old man presents with progressive memory loss and disorientation. MRI of the brain shows significant cortical atrophy and enlargement of the lateral ventricles. What is the most likely microscopic finding associated with this condition? A. Extracellular beta-amyloid plaques and intracellular tau tangles. B. Alpha-synuclein positive Lewy bodies. C. Eosinophilic Negri bodies. D. Silver-staining PIC bodies. Or E. Prion protein accumulation. Pause and select. The correct answer is A. Beta-amyloid plaques and tau protein tangles. Alzheimer's disease is the most common cause of dementia. Amyloid plaques are extracellular, while neurofibrillary tangles composed of hyperphosphorylated tau are intracellular. Understanding these proteinopathies is key for step 1. Case 25. A 5-year-old boy presents with his 4th episode of pneumonia this year. Medical history reveals recurrent sinopulmonary infection since age 6 months and absent tonsils on examination. Quantitative immunoglobulin levels show very low IgG, IgA, and IgM. What is the most likely diagnosis? Case 23. A 60-year-old man presents with fatigue and easy bruising. Peripheral smear reveals large myeloblasts with needle-like inclusions in the cytoplasm, known as Auer rods. What chromosomal translocation is most high yield for this presentation? A. T922, B. T1517, C. T814, D. T1114, or E. T1418? Pause and select. The correct answer is B, the T15.17 translocation. This is acute promyelocytic leukemia, a subtype of AML. The translocation involves the retinoic acid receptor, alpha gene. Treatment with all-trans retinoic acid can induce differentiation. Case 24. A 12-year-old boy presents with persistent left knee pain. X-ray of the femur reveals a large destructive lesion in the metaphysis with a periosteal reaction known as a Codman triangle. What is the most likely diagnosis? A. Osteosarcoma, B. Ewing sarcoma, C. Osteoid-osteoma, D. Osteochondroma, or E. Giant cell tumour? Pause and select. The correct answer is A. Osteosarcoma. The Codman triangle and sunburst pattern are classic X-ray findings. It typically occurs in the metaphysis of long bones in teenagers. Always associate this with the RB and P53 tumour suppressor genes. Case 25. A 5-year-old boy presents with his 4th episode of pneumonia this year. Medical history reveals recurrent sinopulmonary infection since age 6 months and absent tonsils on examination. Quantitative immunoglobulin levels show very low IgG, IgA, and IgM. What is the most likely diagnosis? A. X-linked to gamma globulinemia, B. Severe combined immunodeficiency, C. Common variable immunodeficiency, D. DiGeorge syndrome, or E. Selective IgA deficiency? Pause and select. The correct answer is A. X-linked gamma globulinemia, or Bruton's. The defect is in the Bruton tyrosine kinase gene, leading to a failure of B-cell maturation. Recurrent infections with encapsulated bacteria and absent lymphoid tissue are the discriminators. Case 26. A 20-year-old college student presents with high fever, severe headache, and neck stiffness. Physical examination reveals a petechial rash on the trunk. Gram stain of the cerebrospinal fluid reveals gram-negative diplococci. What is the mechanism of action of the drug of choice for post-exposure prophylaxis for her roommates? A. Inhibits DNA-dependent RNA polymerase. B. Inhibits bacterial cell wall synthesis. C. Binds to the 30S ribosomal subunit. D. Binds to the 50S ribosomal subunit. Or E. Inhibits bacterial DNA gyrase. Pause and select. The correct answer is A. Inhibits DNA-dependent RNA polymerase. The drug of choice for prophylaxis is rifampin. Neisseria meningitidis is the diagnosis. Remember, ceftriaxone is used for treatment, but rifampin is classic for prophylaxis. Case 27. A 30-year-old traveller returning from sub-Saharan Africa presents with cyclical fevers and jaundice. Peripheral smear reveals ring-formed trophozoites within red blood cells. What is the most appropriate initial treatment for severe infection with this parasite? A. Chloroquine, B. Intravenous artesunate, C. Mefloquine, D. Oral quinine, or E. Primaquine? Pause and select. The correct answer is B. Intravenous artesunate. This patient has severe Plasmodium falciparum malaria, indicated by high parasite density and jaundice. Artesunate is the global standard for severe malaria to rapidly clear parasitemia. Chloroquine is ineffective against most African strains. Section 7. Pediatrics, Musculoskeletal, Dermatology, and Ethics. Our final high-yield integration. Case 28. A healthy 18-year-old toddler is brought for a well-child visit. He can walk upstairs with help, has a 10-word vocabulary, and can use a spoon. Which of the following is the most likely additional developmental milestone at this age? A. Jump in place. B. Build a tower of 3 to 4 cubes. C. Run well. D. Copy a circle. Or E. Kick a ball. Pause and select. The correct answer is B. Building a tower of 3 to 4 cubes. By 18 months, fine motor skills include using a spoon and building a small tower. These milestones help you assess neurodevelopmental progress. Remember the rule of 2 for 24 months, 2-word phrases, and 2-step commands. Case 29. A 25-year-old man presents with a symmetric rash on his palms and soles. The lesions are red, circular, and have a central dusky area, resembling a target. He reports a recent outbreak of painful oral sores. What is the most likely inciting factor for this patient's skin condition? A. Herpes simplex virus infection. B. Mycoplasma pneumonia. C. Penicillin allergy. D. Phenytoin toxicity. Or E. Sulfonamide exposure. Pause and select. The correct answer is A. Herpes simplex virus. These are classic target lesions of erythema multiforme. While drugs and other infections can cause it, HSV is the most common trigger. Remember, if it progresses to mucosal involvement and sloughing, consider Stevens-Johnson syndrome. Case 30. In a case control study of pancreatic cancer, 100 cases and 100 controls are enrolled. 50 cases and 25 controls report a history of heavy smoking. What is the odds ratio of pancreatic cancer for heavy smokers compared to non-smokers? A. 2.0, B. 3.0, C. 4.0, D. 0.5, or E. 0.25. Pause and select. The correct answer is B. 3.0. The odds ratio is calculated as a times D divided by B times C. 50 times 75 divided by 25 times 50. This results in an OR of 3, indicating smokers have 3 times the odds of cancer. Finally, let's consolidate your knowledge with the 10 USMLE rules that save questions. These principles will help you navigate even the most complex vignettes. 1. Stabilize the patient before pursuing a detailed diagnosis. 2. Airway, breathing, and circulation come first. 3. Identify the disease timeline. 4. Use the strongest discriminating clue. 5. Separate screening from confirmation. 6. Separate the initial test from the most accurate test. 7. Separate initial therapy from definitive therapy. 8. Consider medication adverse effects and contraindications. 9. Look for prevention opportunities. 10. Answer the exact question being asked. Thank you for studying with Sinoe Medical Association. Continue practicing active clinical reasoning. Like, follow, and subscribe for more high-yield USMLE content. Good luck on your exam.